Once in a while, we can have a situation where a retinal detachment presents with a macular hole. Now, these macular holes are considered secondary holes, and so when doing buccal surgery, no attempt is made to close the hole or to do any intervention for management of these holes. However, when managing these detachments using vitrectomy, ILM peel may be attempted in an attempt to facilitate the closure of these holes. So the ILM peel in a situation where the retina is detached is slightly different, and this video is about demonstrating how to do that. Now the tool being used are Lander's flat lens, which provides a very crystal clear unmagnified view, and the forceps which is being used is Greishaber ILM forceps, and this is a 23 gauge forceps which will be used for peeling the ILM. Now this technique, which is known as pinch and peel, is basically designed to catch and pinch the internal limiting membrane, which is the innermost layer of the retina, and then pinching that, the layer is tangentially pulled so as to create a flap. Now when doing these peels in a normal attached retina, there are a few nuances, especially that the retina is not mobile and it is resting on the choroid. However, what I feel that pinching and peeling, especially the pinching part, becomes much safer when you are peeling ILM on a detached retina, because the retina is suspended in the cavity and it is not resting on choroid, so there is an amount of play which you have when you are managing to pinch and hold the retina. Retina is a very friable tissue, and if it is sandwiched or pressed by the forceps on the choroid itself, the retina gets edematous immediately and there may be retinal hemorrhage. However, when retina is detached, this possibility is not there. We can see a small hemorrhage here, which was due to inadvertent contact with the vitrectomy tool. However, there is no hole here, it is just a small hemorrhage, should not matter. So usually the ILM is stained with brilliant blue dye, which is a dye which is supravital dye, and it doesn't damage the tissue, although this also has been debated, but this is something which has to be done so as to visualize this transparent internal limiting membrane, which is not only transparent but very thin. So staining with brilliant blue dye provides it a blue hue, and once we peel it away, the underlying color of the natural color of the retina provides us a good contrast to differentiate between the ILM and the neurosensory retina. So here we can see the ILM is being peeled piecemeal because it's a friable membrane and it is very much possible that while pulling it, it gets broken. So once the flap has been raised, we take some time to peel it, and I would like to add here that the surgery is so delicate that one has to hold his breath so as to stabilize the hand which is trying to pinch and grab the flap of the ILM on the surface of the retina. Now here I am not using any assistant to hold the Lander's lens, and just by manipulating it with the free fingers, so there are thumb and two fingers which are holding the light pipe, which is 23 gauge wide angle tip, and holding the forceps with two fingers, one is thumb and one finger, and rest of the fingers are used to stabilize the Lander's lens and to manipulate it as and when desired. So we have reached to completed to peel a sizable area of ILM, and the target is to peel up to the arcades. We can appreciate the hole is quite large and the margins of the hole are everted, and this patient has had traumatic retinal detachment, and if it is primarily because of trauma, then the prognosis for the closure and visual gain both become poor. However, once you have access to the vitreous cavity and it is possible to hold the ILM and peel it, it is desirable that it should be peeled away. Peeling the ILM also provides to peel away the cortical vitreous which may be attached to the retinal surface and may later on cause macular pucker. So at times peeling may be a desirable option provided it can be done safely without traumatizing the retina. I find these ILM forceps from Greishaber ILM to be very useful in pinch and peel technique where no other tool is required to raise the flap, which earlier was used to be done using a diamond dusted membrane scraper, but these forceps are very accurate and they are able to pinch the ILM without causing any damage or pinch on the neurosensory retina. So once we have finished off peeling the ILM as per the desired area, the patient is put under tamponade so that the retracted edges of the macular hole may come back and join each other. So the hole is closed by repositioning of the tissue which has retracted outwards. Here you can see the retina is detached and it starts lifting up with each attempt at pulling the ILM, but ultimately it is peeled away. So we have now peeled away the desired area of ILM and surgery is done. Thank you.